Understanding shock management from a nurse's perspective involves a comprehensive understanding of the physiological mechanisms underlying shock, as well as the nursing interventions and strategies required to effectively manage it. Shock is a critical condition in which there is inadequate tissue perfusion, leading to cellular dysfunction and organ failure if not promptly treated. Nurses play a crucial role in the assessment, identification, and management of shock in patients. Here are some key points to understand. Types of shock. Nurses should be familiar with the different types of shock, including hypovolemic shock due to loss of blood or fluids, distributive shock, for example, septic shock, anaphylactic shock, cardiogenic shock related to heart failure, and obstructive shock due to obstruction of blood flow. Assessment. Nurses assess patients for signs and symptoms of shock, such as low blood pressure, rapid heart rate, altered mental status, cool and clammy skin, decreased urine output, and signs of organ dysfunction. Fluid resuscitation. In hypovolemic shock, nurses administer intravenous fluids to restore circulating volume and improve perfusion to vital organs. They monitor fluid balance closely to avoid fluid overload or worsening of shock. Vasoactive medications. In distributive shock, such as septic shock, nurses may administer vasoactive medications like vasopressors to improve blood pressure and vascular tone. Oxygen therapy. Ensuring adequate oxygenation is crucial in shock management. Nurses may administer supplemental oxygen and monitor oxygen saturation levels to optimize tissue oxygen delivery. Monitoring. Nurses continuously monitor vital signs, fluid balance, urine output, laboratory values, for example, lactate levels, and organ function to assess the patient's response to treatment and adjust interventions accordingly. Collaboration. Shock management often requires interdisciplinary collaboration with physicians, respiratory therapists, pharmacists, and other healthcare professionals to coordinate comprehensive care and interventions. Education and support. Nurses provide education to patients and their families about shock, its causes, treatment modalities, and potential complications. They also offer emotional support and reassurance during the critical phase of shock management. By understanding these aspects of shock management, nurses can play a pivotal role in improving patient outcomes and ensuring timely and effective interventions to stabilize patients in shock. And as always, thanks for watching.